More measles cases are being reported today by the Texas Health Department. Infections have now surpassed 220 cases. Most of those cases are in unvaccinated children. According to CDC data, vaccine rates for diseases like the measles are falling in more than 30 states in 2024. Lee Waldman spoke to healthcare professionals who are concerned about this trend.
The emergence of measles needs to bother more people than it is bothering nationally right now.
Though they're states away, Dr. Jim McDonald with the New York State Department of Health is very concerned about the measles outbreak in West Texas and New Mexico.
Measles is not a harmless childhood infection. If you look at the Texas outbreak in particular, a little over 1 in 5 people are ending up in a hospital.
McDonald points to falling immunization rates as the reason behind the outbreaks. CDC data found vaccination coverage among kindergartners across the U.S. dropped to 92.7% for measles, mumps, and rubella vaccine during the 2023 to 24 school year.
When vaccine rates erode, and they have eroded to the point where many jurisdictions now have vaccine rates that are well less than 95%, which is what's required to prevent measles, we're starting to see measles come back.
Dr. Paul Offit says there's an increase in vaccine skepticism and a rejection of them after the COVID-19 vaccines.
I do worry that as immunization rates continue to erode, that the children will once again suffer.
The CDC says measles has a mortality rate of 1 to 3 per 1,000 cases in children. With 2 deaths confirmed from the current outbreak, Offit fears the current number of cases is much higher than currently reported.
This is a highly contagious virus, and I don't think people realize how sick it can make you.
In New York, Lee Waldman.